Since 2000, Burundi has found that it has a high population growth rate.
All of us must be aware of the problem we are facing now.
If nothing is done today, all government's efforts in terms of development may be hampered.
Because our population density is estimated at more than 70 inhabitants per square kilometer,
we have children that will not be able to feed and provide with schooling.
In addition to that, we have a very high maternal death rate.
One of the major priorities of this country is family planning and teenage health.
The government has declared a demographic policy in which it is stated that from now on to 2025, we must have a maximum of 3 children per woman per family, whereas right now we have 6.4 children per woman per family.
One can never develop a country without knowing the number of its inhabitants.
We have carried out census data analysis in order to highlight the demographic challenges. An advocacy plan has been addressed to the highest authorities.
And today we are planning everything basing our action on the results of the national census that has been organized by the support of UNFPA. And I think that the results that have been reached can be an example for other countries that may not regularly organize this type of work.
Our church goes for family planning, especially because it is not against the Bible. Islam recommends family planning for the benefit of the family.
In what we call the Declaration of Gitega, signed by all religious leaders, Catholics, Muslims, and Protestants say that they agree on the fact that there are demographic challenges in this country and family planning must be carried out.
In the synergy, there is the Catholic Church that includes 22 parishes, Islam that involves 10 churches present in the conferences, and the rest are Protestant. I think that no one is left out for the time being. But we face the declarations of the Catholic Church in Rome saying that contraception is not taught at the level.
Our answer is that we respect their stance. By we, I mean the government and UNFPA, but just allow us to settle secondary health posts next to the health care centers managed by the church.
We finally decided that even if we do not practice family planning in our healthcare centers, we are not going to oppose it because it's a time bomb that we are hosting. According to the teaching of Prophet Muhammad, peace be upon him, the maternal breastfeeding must cover a period of 2 years, and that is one family planning method. We advise the population to adopt family planning and include it in their daily life because life has become practically impossible with the present population growth rate. Family planning must be for the benefit of the mother, the child, and the relations.
The strategies put in place were to first create family planning posts next to the religious health centers.
The religious confederations didn't accept the modern family planning methods. And we wonder how we could increase access to those methods. Then we decided to create a health post that will reduce the distances covered by the woman. There are 10 applications per day on average, but the demand went increasing.
When women come for family planning, we give them methods, injections, implants, and pills. In this area, there are some health posts that don't provide the long-term methods.
easy access to those methods will increase the contraceptive prevalence rate.
We have many secondary health posts next to the religious health centers.
But also concerning the strategies, we encourage people to use the long-duration action methods in order to avoid interrupting or forgetting.
If you look at it closely, we have an accessibility problem with the hills. People talk about 1,000 hills. The risks caused by missing to take their pills stress on some methods such as implant, IUD, and so on.
My husband and I discussed seriously about family planning and family health because good parents must enjoy good health for good reproduction.
I gave birth to 5 children, but only 3 are alive. The use of the intrauterine device helped me a lot. One of the coordinators explained to us how to use it, and we now use it very well, and we understand its importance. On the other hand, the intrauterine device helps women save time in not going to the doctor for renewing pills or for injections.
Here, men do not show concern for family planning. Only women are involved, and sometimes they don't necessarily get the agreement of their husbands, and that causes problems. So women abandon the methods or try to get them secretly.
At first, most of the contraceptive methods were not accepted by the populations.
Men must absolutely get involved because here, just like in other parts of Africa, they are making the decisions in the family. They decide what is to be done, and women have very little capacity to impose their will. That is why men must also be involved in the health programs, especially in the reproductive health.
With development, we noticed that a significant number of men willingly accept to undergo vasectomy. We also noticed that the method is beginning to be accepted in our society, which is all the more remarkable since in our culture, contraceptive methods have always been associated with women.
When a couple chooses vasectomy, it's made known to them beforehand that it is a definitive method. First, all of the methods are explained to them. There are long-term action methods such as implant, the IUD, and short-duration action methods such as injections and pills. Once a couple agrees on not having children anymore, vasectomy can be executed on the man. Everything has gone all right. I feel very good. I decided to have a vasectomy taking into account the health of my wife. When people are told about family planning, they sometimes think it's a burden that only women have to bear. But me, as a servant of God, I took pity of my wife, so I decided to give her respite by undergoing myself the vasectomy operation. We had a discussion on how to stop making children and just keep the ones we already have. After the doctor's explanation, we understood that it's possible. He gave me 5 days to think about the procedure, and then I decided to undergo vasectomy. There have been no complications after the operation. Life goes on well, and our couple has no problems. A woman came to us and said that she wanted no more children. We told her about the existence of vasectomy. Then she informed her husband, who accepted. They came together and we carried out vasectomy operation. It was a success.
You see, during our meetings on the hills, I was often asked to talk about my experience. Actually, men in our community ask me if we have any problem in our life as a couple, and I tell them that everything is going well.
I informed many neighbors. I talked to them about my experience, and 5 of them went to take vasectomy. They also declare having no problems. Besides, God said that we must love our wives as we love ourselves.
À partir de 2006, Son Excellence le Président de la République a
In 2006, His Excellency the President of Burundi declared free medical care for childbirth, diseases related to pregnancy, and for children under 5. The decrease of maternal mortality resulted from that decision because the financial barrier that used to prevent most Burundi women from giving birth at the hospital or going there for health care is now raised. In 2005 or before, only 20% of Burundi women used to give birth in medical facilities, but now over 70% of them do so, and the population has been sensitized at all levels, even at community level.
Jusque même au niveau de la communauté. Maintenant, nous voulons.
Now, we want to involve the community health centers in the distribution of the contraceptive methods.
In all the messages that we give to the populations, in all the meetings that we organize for them, the following message is never missing, urging the populations to reduce this demographic growth.
Les femmes viennent volontairement demander les méthodes contraceptives. Même si la femme ne vient pas.
The women willingly show up to ask for contraceptive methods, and even if they don't come for family planning, but for medical care for their babies, we organize informative sessions for small groups of no more than 10. They all sit down in an exchange session with the specialist.
Donc, c'est un échange.
Dans notre centre de santé, la sensibilisation marche bien. Ça se fait de deux côtés. Premièrement, la sensibilisation.
In our health center, sensitizing is going on very well. It is carried out at 2 levels. Here at the health center by the staff and at the community level by the community health agents. At the community level, each of the community health agents who were trained for such a task takes care of groups of 10 to 20 persons. The importance of family planning methods is explained, and all the methods available and accessible at the center are presented. So the methods are considered one by one and explained, and sometimes one staff member, either the agent of the health center or one of the nurses, go and help the community health agent to sensitize at community level.
We have begun the lessons in our classes, and each teacher uses topics such as family planning and protection against the HIV/AIDS.
And we dealt with the training. There is no more theoretical training. People are taken to the sites and given practical training.
We have organized a training session for the health promotion technicians on reproductive health activities, including giving injections at the community level.
We even trained the nurses in the health centers. Now they know how to place an IUD and implants. Now, even in the furthest parts of Burundi, you will see that the agents know the long-duration action method.
We have supported the government in identifying several community agents to send to the field. We trained them and gave them necessary tools. We have implemented a strong strategy in addition to the mobile clinics we used to get to inaccessible areas.
During this training session, which was in fact a trainer training session, we highlighted a special strategy, the competence approach that emphasized gesture-based acquisition and not only theoretical acquisition. We used a technique we call humanist technique, consisting of using during the training session a maximum of anatomic models that are closest to reality. As you know, it is a must for the participant to acquire the necessary skills, so we train them at perfectly mastering the competence on the anatomic model before working on the patient. Luckily, UNFPA Burundi provided us with the necessary pedagogical material needed. Now, we add another component consisting in giving injections at the community level, as the community health agent and the health promotion technicians are now trained in reproductive health. The people can get modern contraceptive methods that are not given by the religious centers. In other words, the agent will be able to administer the methods to those who want to use them. That's very important for the country. In Burundi, injections are the most used method. Women prefer it. Once the health promotion technicians are trained, they will make the method available at the community level for the good health of the mothers.
This is a health center that has already made a step forward regarding service supply. It is a training center for the service suppliers in terms of placing and withdrawal of IUD. We have trained many people, many nurses from various districts, various provinces, Ngozi, Bujumbura, Kayanza, Chibitoke, Bubanga, etc., which means that we have trained many people.
I think that we're lucky, if I may say so, to have a country that doesn't cover a large area. Our drug supply system is well controlled in general, from the center to the periphery. The same goes for contraceptives. We have a national reproduction health program that oversees the transportation of the contraceptives all the way to the health centers. We even have a software, the channel software, that helps us manage efficiently the contraceptive and other drugs in order to avoid stockouts at all levels. It is safe to say that in this field, we have reached success so far. I will take this opportunity to thank the partners in the name of the government of Burundi. For 6 years now, no contraceptive stockouts have been recorded, which means that any woman, girl, or even man who needs certain methods can get them in time. Regarding reproduction health, the United Nations Population Fund takes the leadership, even when it comes to attracting other partners. We definitely appreciate the cooperation between Burundi and UNFPA.
With the government's support and within the framework of what they call the second generation strategic frame for the fight against poverty, covering the 2012-2016 period, we have no more stockouts in the country. And following the government's request and mainly with regard to the population's needs, we emphasize the long-term family planning methods.
Most of the strategies that I told you about were developed together with UNFPA.
Thanks to that organization, the government of Burundi is now aware of this important issue. UNFPA is the first organization to open the thinking process because it gave a positive answer to our request. I also think that it deserves encouragement because it has experts and other specialists needed to get the family planning messages across. UNFPA has done a great job that we appreciate a lot in Burundi. Considering what they have done in terms of sensitizing and in supporting national programs, it's an international organization we really appreciate. We appreciate what it's doing in our country and we encourage it.
First, I thank the government very sincerely. When we look at the use of its different budgets from 2000 to 2013, we can notice that each year the share allotted to contraceptives and obstetrical care has substantially increased. This proves once again that it is a practical, not a theoretical commitment, in addition to what the President and the First Lady are doing at field level in terms of advocacy and sensitizing. Secondly, it is to be mentioned that following the results that UNFPA obtained from the population and health census based on the demographic challenges which were raised, we collected over $1,500,000 from the Belgian Corporation for the Fight Against Fistula. The European Union has pledged to give us $3 million for family planning, and this year the Netherlands will support our acquisition of contraceptives for an amount of more than $2 million. This shows the mobilization role played by our office.
In 2000, we had a contraceptive coverage rate that did not reach 10%. Now we are at around 25%. That's considerable progress.
Partners will support us in contraceptive prevalence rate increase because we are convinced that in order to reverse the trend of the demographic growth rate in this country, we must reach a 50% contraceptive prevalence rate increase. We are at 25.3% and we expect to reach 40% by 2015. The indicators show that we are on the right path.